Hi everyone, my name is Zubair. I'm a nuclear medicine resident, and in my daily practice I see many patients with thyroid-related diseases. That is why I decided to create a series of educational videos in which I explain everything related to the thyroid gland from normal physiology to pathology, as well as important diagnostic tools. You can choose to watch the entire series, or you can visit the playlist and select the videos that interest you most. This is the first video in a series of 4 about the thyroid gland. In this video, we will do a quick and clear review of thyroid physiology. The release of thyroid hormones is regulated by the hypothalamic-pituitary-thyroid axis. The hypothalamus releases thyrotropin-releasing hormone TRH, which stimulates the anterior pituitary to release thyroid-stimulating hormone TSH. TSH then travels through the bloodstream to the thyroid gland, where it promotes the production and release of thyroid hormones. The thyroid gland produces two hormones, T for thyroxine and T3-triiodothyron. Although T3 is more biologically active, about 90% of the hormone released is T4, which is later converted into T3 in peripheral tissues. Both TRH and TSH are regulated by a negative feedback loop involving circulating T3 and T4. More than 99% of T3 and T4 in the bloodstream are bound to proteins such as albumin and thyroxine-binding globulin TBG. Only the free and bound fraction less than 1% is biologically active. Thyroid hormones are produced in the colloid of the thyroid follicles when iodine binds to thyroglobulin. Iodide ions are actively transported from the blood into follicular cells, where they are oxidized and attached to tyrosine residues by thyroid peroxidase enzymes. 1 iodine and 2 iodine intermediates combine to form T3 and T4, which are stored in the colloid until TSH stimulates their release into the bloodstream. Thyroid hormones are often called metabolic hormones because they regulate the basal metabolic rate. They increase ATP production, stimulate glucose metabolism, raise body temperature through the calorigenic effect, and are essential for growth, fetal development, nervous system function, and reproductive health. Excess levels increase heart rate, cardiac contractility, and blood pressure. Because thyroid hormones affect many systems in the body, thyroid disorders can have widespread consequences, which will be discussed in the next videos. After a nuclear accident, people may take iodine pills to protect the thyroid. The gland cannot distinguish between stable and radioactive iodine. By saturating the thyroid with stable iodine, radioactive iodine absorption is prevented and the excess is excreted by the kidneys. Summary: the thyroid gland uses iodine to produce T3 and T4, which regulate metabolism throughout the body via feedback systems similar to a thermostat.